Before the 1860s, little to no hygienic measures were taken in surgical operations. In a civilization plagued by preventative surgical death rates, patients under hospital care were dropping by the thousands. Faced with exorbitant mortality rates for patients undergoing surgery, surgeons were riddled with confusion as they desperately attempted to answer the question on everyone's mind: what could be causing so much death, and how can we stop it? Joseph Lister pioneered the field of preventive medicine, standing up for his antiseptic theory concerning the spread of microorganisms despite skepticism from fellow surgeons, eventually saving countless lives from death by surgical infection. Joseph Lister was born in Essex, England on April 5, 1827, to a family that valued his education and sought to stir his intellectual curiosity. At the age of 25, Lister was accepted into the Royal College of Surgeons, beginning the career of who would become known as the father of modern surgery. Death from post-surgical infection was so common in the 19th century that it was considered a medical condition and given the names ward fever and hospital disease. The unfortunate reality was that surgical incisions provided a route of infection by various microbes, a process now known as sepsis. Doctors during the time period recognized that something in the air must pertain to the spread of the infection, and often took steps to ensure clean air, such as opening windows, cleaning linen, and occasionally building brand new surgical wings, none of which, however, offered the solution. In fact, the development of anesthesia was a direct contributor to sepsis mortality. No longer rushed to complete the surgery to cease the patient's pain, surgeons would often keep surgical wounds open for substantially longer periods of time, prolonging the exposure for potential bacterial infection. Early on, Lister's scientific interest was spurred by pathology and inflammation, in which he demonstrated a keen academic mindset. However, upon reading Louis Pasteur's revolutionary germ theory of disease, suggesting that organic materials, including tissue, rotted as a result of living germs, and that life can only come from other life, Lister instantly formulated a possible theory through which blood became infected. In Pasteur's work, he displayed several methods to abate the infectious germs, including through the use of particular chemicals. Lister set forth finding the ideal chemical to use in surgery. At the time, carbolic acid was used to deodorize sewage, as modern waste processing techniques were not available. Lister learned that the acid could be safely used on human flesh, and, starting in 1865, applied carbolic acid directly to surgical openings and post-operative recovery. After encouraging results, he used carbolic acid to wash his hands, instruments, and bandages applied to patients. Lister also sprayed the air with the acid to eradicate airborne germs. After a year of using and refining his techniques, Lister's work led to a decrease in surgical mortality rates from 45% to 15% of patients, a monumental success at the time. He published his results in the medical journal The Lancet in 1867. Lister returned to Edinburgh, Scotland to become professor of clinical surgery, where he introduced his antiseptic procedures to the public, and again found dramatic achievement. After 1870, Lister experimented with gauze saturated with various antiseptic substances in place of carbolic acid. In 1871, he also used a chemical spray to purify the air in an operating room. The carbolic acid sprayer was, in essence, a pump with a long handle, and was abandoned when Lister realized the lack of pathogenic organisms in the air. Lister even announced, "I'm ashamed I should even have recommended it for the purpose of destroying microbes in the air." Those setbacks led to a diminution in support for Lister's young antiseptic principles. Praised by his staff and those who had studied the details of his technique, Lister's antiseptic practice was highly acclaimed in Germany and most other countries, but not in London. In 1877, Lister accepted a position as professor of surgery at King's College Hospital in London, as he felt as though it was his mission to promote his principle. London surgeons were certainly not persuaded, however. One sarcastically asked the nurses to close the door so as not to allow Mr. Lister's germs to come into the room. Lister's work was continuously belittled, not only by surgeons at King's College Hospital, but also by medical professionals across the world. Some busy doctors were unwilling to take the time to consider new ideas. Others found it difficult to believe in microscopic germs, living organisms that brought about death but were too small to see. Others still attempted Lister's procedures, but did so incorrectly, and consequently failed to achieve the desired result. The reason for this lied, in part, in the complexity of Lister's techniques and the frequent alterations he made to his systems to improve them. Many believed Lister's methods were merely unnecessary additions to the expense involved in dressing wounds. Some doctors even thought Lister's practices were an insult to their ways of surgery. Lister refused to be angered or discouraged by the cloud of controversy surrounding his work. As described in the book Great Men of Medicine, Lister went on his gentle, non-concerned way, saving his patients and trying to cheer them up while doing so. Lister was driven merely by the thought that he could make a difference in the field of surgery. His compassion toward his patients demonstrated a personal involvement during procedures, as opposed to the arrogance of the surgeons of Lister's time, who believed that such condolence would lessen the holy awe and respect in which patients should hold their doctors. Despite the critics who fought against the revolutionary techniques, Lister's methods gradually gained acceptance. First implemented in Denmark and Germany, antiseptic practices met with incredible success, and by 1875, Lister was receiving international acclaim across Europe. However, Lister understood that before his techniques gained worldwide acceptance, he would first need to win over the city of London. Lister's chance finally arrived in 1877. On October 26th, at King's College Hospital, Lister performed the revolutionary operation of wiring a fractured patella. The procedure involved the conversion of a simple fracture into a compound fracture, which commonly resulted in infection and ultimately death. Lister's proposal of applying his antiseptic method to perform the surgery was widely publicized and arose much opposition from English doctors. As a result, the success of the operation carried out under antiseptic techniques forced surgeons across the world to finally accept that Lister's method had greatly aided in the safety of operative surgery. Thus, after 12 years of arduous research, painstaking trial and error, and intense opposition by the entirety of the medical world, Lister's young dream of a world free of surgical death by infection had become a reality. Modern methods of preventing infection include antibiotics, penicillin, sulfa drugs, and sterilization. Antiseptics continue to play an important role in the field of medicine to this day, and are a true enduring monument to Lister's vision. Joseph Lister's innovation hit the medical community at a time when doctors were unwilling to accept the impact of microscopic life on human health. In the early 19th century, many believed changes in the air caused most diseases. Pasteur's germ theory was not yet widely accepted, and Lister's antiseptic theory was at first rejected. However, Lister took a stand for the millions of patients who had fallen at the hands of infection. Lister refused to succumb to the surgical horror caving around him, and chose to pioneer a solution to the bacteria-caused disease plaguing his society. Lister's legacy forms the basis of surgical methodology in modern medicine. Wounds, sites of incision, and surgical instruments must now be kept free of bacteria. As Joseph Lister once said, "I trust I may be enabled in the treatment of patients always to act with a single eye to their good." And so he has, sustaining surgical techniques throughout centuries that have saved countless lives and serve as a reminder that the will of one man can turn the tides and accomplish a feat truly timeless in value.
Investigation into the nature of inflammation and the healthy and morbid conditions of the blood in relation to it, I arrived several years ago at the conclusion that the essential cause of suppuration in wounds is decomposition, brought about by the influence of the atmosphere upon the blood or serum retained within them.